You can treat many causes of vertigo at home. When you suffer from vertigo, it's usually possible to make it less severe. The classic vertigo disorder, BPPV, is the one most responsive to exercises. There are 3 canals in the ear, and the half somersault and Epley maneuvers are for the most common affected one, the posterior canal. Sometimes the crystals are in one of the other 2 semicircular canals, and those each have a different maneuver to remove the crystals. The horizontal canal can cause severe vomiting if it is affected. A special maneuver, the Gufani maneuver, can relieve this type. It's also possible for crystals to get stuck inside the canal. This may require you to see a trained provider for removal. If exercises don't seem to be working, you will need to seek outside help. See our book and videos on the half somersault maneuver and BPPV for more information. Sometimes your vertigo will turn out to be due to other causes for which the BPPV exercise is of no help. If your ear has been damaged recently by a virus, for example, you might see the room spinning for days. Your brain has the ability to learn to pay more attention to your normal ear and less to your damaged ear, a process called compensation. This means that even vertigo due to serious inner ear damage can gradually subside over time. To help this process, you need to try making movements that increase the dizziness. Going for walks and moving the head is particularly helpful. If a special movement, like turning the head quickly, sets off the dizziness, repeating it many times can help solve the dizziness permanently. Sometimes spinning is worse when looking in one direction. For example, you might notice that looking to the right makes vertigo much worse, while looking left slows it down. The treatment is to practice holding your gaze in the bad direction. This can reduce the spinning over the course of several days. Providers can teach you exercises for this, called vestibular rehabilitation. The more you do, the quicker you can recover. Permanent damage to the inner ear can also interfere with focusing your eyes. You might notice that turning your head quickly makes the room appear to shift in a blur, like a bad video. This is called oscillopsia. To reduce this, practice turning your head while blinking. Pick a point to focus on to your right and another point to your left. Look at the focus point, close your eyes, and turn your head quickly to the other focus point. Repeat this several times and then rest. When your eyes are closed, the room doesn't appear to shift, so learning to blink when turning the head helps prevent this symptom. You should turn your head very quickly so that the eye closure is no more than a blink. Not all vertigo responds to home treatments or exercises. For example, people with Meniere's disease have spells of spinning with vomiting that recur in spite of therapy treatments. In those cases, it's necessary to figure out exactly what's setting off the spells and try to stop them that way. Migraines that cause dizziness will not respond to practice exercises. You have to find a medication or lifestyle changes that can help. Sleep apnea can be treated with CPAP, or the vertigo and dizziness will continue. Anytime your vertigo continues in spite of home treatments, you should see a provider. We have many providers here at the University of Colorado who can help you in the departments of otolaryngology, audiology, and neurology.